This video provides a detailed walkthrough of the technical aspect of pulse index conto continuous cardiac output calibration. We begin in the north post room, where the consumables are stored. We start here because doctors need to insert a special arterial line into the patient's body. We store two lengths of PiCCO arterial lines, 22 centimeters and 20 centimeters. While the longer length is often the preferred choice for most patients, please consult the doctor for their specific recommendation. Additionally, please ensure to collect only one arterial line and one injector housing, as combined cost of these items is nearly £300. Please collect the PiCCO module from the equipment room located in the north wing. Inside the designated drawer, you'll find modules with attached cables. Please refrain from disconnecting the cable from the module, as this could potentially damage the pins in the plug during alignment. Additionally, you'll discover helpful papers stored in the same area. The laminated ones are meant to remain at the bedside and should be returned here after use, while the non-laminated ones are suitable for reading outside clinical areas. All these documents are available on the S drive at Medical Device Library /Getinge, PiCCO. Also, kindly ensure that you have access to the S drive. If not, please contact the IT department for assistance. Once PiCCO plans are initiated, please ensure to check the fridge for 250 ml bags of normal saline. You will need 6 bags per day, and they require a few hours to cool to below 7 degrees Celsius. We opt for 250 ml bags because they are less susceptible to temperature fluctuations over short periods of time. Begin by checking the patient's admission details on the monitor. For further calculations, we require gender, height, weight, and date of birth. Next, insert the PiCCO module into the holder and wait for 20 seconds for activation. Then, navigate to the devices list and verify if the module is activated, not grayed out. If not, please press Activate. Press the CO button on the module, and within the menu, select Auto Mode to avoid touching the screen during the tests. Connect the transducer set to the new arterial line, followed by the temperature cable from the module. Mind the groove on the plug, which should be aligned with a notch in the socket. Before proceeding, consider if there is an old, standard arterial line already in place. It's essential to remove the original arterial line to avoid confusion. Connect the transducer to the injectate port of the central line. It's important to note that the injectate port should be connected directly to the central line's brown port with the 3-way tap attached distally. Ensure all connections are securely fastened. The injection port should be secured with a bio connector as usual, and no octopuses attached, or infusion should be administered through it. Install the temperature probe on the injectate port. When properly aligned, these two parts will click effortlessly. Do not force it. Just before injection, the port should rest on a sterile field and be wiped with a chlorhexidine wipe. Let's return to the monitor. To activate the thermodilution screen, select the word Standard at the top of the screen. This will display the available screen modes, from which you should choose PiCCO. Now touch newly appeared on the bottom of the screen cardiac output button. Take note of the alarm section, where you may see PiCCO no ABP. This alarm appears because PiCCO data must come from ABP, not the usual ART label. If the label did not change automatically, please adjust it manually. Simply touch the arterial curve, then locate Label in the opened menu, and choose ABP. Once the label on the monitor is updated, the blood pressure will be visible in hemodynamic measurement on EPR, not in the usual vitals. Next, zero the arterial and central lines. Keep the CVC value in mind, as it may come in handy soon. Now, let's move on to the procedure. Retrieve cold normal saline from the fridge and ensure there is enough for the next measurements. Use a paper tray and avoid touching the bag directly. Open the external packaging and wrap the saline bag in a sterile towel. The saline should not be warmer than 11 degrees Celsius, preferably below 7. Moving forward, please focus more on the bottom of the screen for prompts. Press the Start PiCCO button and await the prompt Inject Now. The volume to be injected is calculated by the monitor and displayed. If necessary, you can adjust the volume by touching the number according to the formula. 15 milliliters for patients below 100 kilograms and 20 milliliters for those above 100 kilograms. Inject the bolus of cold saline smoothly and quickly within 1.5 to 7 seconds. Being careful not to warm up the injected volume with your fingers. Once the injection is detected, the actual procedure begins, and a green curve will build up on the screen. Please note that the bottom line indicates the actual patient's temperature, while the line above marks 0.2 degrees Celsius below. The rising curve must cross this level for the injection quality to be sufficient for PiCCO calibration. Repeat the procedure a minimum of 3 times. If the quality of one injection is not satisfactory, repeat it when prompted by the monitor. To stop the measuring mode, press the Stop PiCCO button on the screen. Any insufficient measurements can be removed from the calculations by touching the test in question to mark it red. Test marked red will not be taken to calculations. Once at least 3 good flushes are achieved, press Save PiCCO and then Hemo Calculation button. In the opened result window, check CVPM value. If the CVPM field has not been updated automatically after the last cold saline flush, perhaps due to the central line tap remaining closed, touch the field and input the memorized value from the time of zeroing. Touch the Perform Calculation button to recalculate SVRI along with other parameters. Ensure that the results are accurately recorded in the electronic patient record. Navigate to the Adult ICU Quick View section and enter the Hemodynamic Measures section. Double-clicking on the blue band where the time cross-section is located will open a list of hemodynamic devices. After selecting PiCCO, most of the data should populate the form automatically. The entire procedure must be repeated at least every 6 hours. However, with sicker patients, it may need to be repeated more frequently.